Guys, lip fillers, something that a lot of people want to know about, and people also getting it done. So in this video we'll be talking about what are lip fillers, how we do them, what are the different types of lip fillers that are available in the market, and basically what we can achieve with them. Also, one important thing that we'll talk in the end is what we don't do to make your lips look ugly. Hi, I'm Dr. Saumil Shah. I'm a plastic surgeon, director of plastic surgery at Skin Zone Aesthetics in Borivali West in Mumbai. What are beautiful lips? This is something that is such an enigmatic topic for the simple reason that for different people it means different things. Some people like plumpy lips, some people like fuller lips, some people like lips that are just glossy and they are not too big. However, this is something that is a very personal choice, and that is why fillers are such a good thing to do for the lips. Now, what are fillers? Fillers are basically gel that comes in syringes like this. We, using needles or cannulae, which are basically blunt needles, we inject this into the lips to give the shape that our patients desire. It also helps us to modulate the volume and to judge how much they want and not want. We can underdo sometimes and then do a little bit more when they require as well. So this is something that fillers allows us to do very well, and so that's why they have become such a popular thing to not just volumize the lips but also shape them. And this is something that I'm going to talk about next. So when we talk about lips, here are a few things that you need to know. What are the things that we actually look at in doing lip fillers? So here I have marked as to what a lip normal shape would be. So if for you this outline of the lip is an issue, then we can sort of shape your lip to give you a sharper outline. It's something that a lot of women do when they go outside their lips to apply the lipstick to increase the size of their lips or to shape it properly. So this is something that we can do using fillers. Second thing that a lot of you would have seen are women with volumized lips or bigger lips. This is again something that can easily be achieved with the filler. However, you would have seen people with those duck lips. If you remember Anushka Sharma, she became very notoriously famous in that Karan Johar show where she had a lip which was wide, very full, especially on the sides. And that's why it's something that we as plastic surgeons will advise you not to do. So where do we put the fillers? There are a few landmarks on your lips that we want to highlight. The first is, of course, as I said, the margin of the lips, the top and the bottom. Second, you have to understand is this area which we call the cupid's bow. Just below that, to have a nice sort of a small pout, what we want to do is fill up this central area. This central cushion of the upper lip will sit on the two outer cushions or the side cushions of the lower lip, and that is how we actually want the shape to be. That is also what gives you a good pout. Now, depending on whether you want a bigger pout, you want a smaller pout, you want a lip that is if I say sexy, or you want a lip that looks nice and finessed, we can change them. Lip fillers can also be done in another area which I have marked as 3. This is basically the body of the lip. In a lot of patients who have these very thinned out lips or who have lips that are thin with age, we can do them because this gives volume to the lips and it decreases that pursed lip look. This is something that gives you a look which makes you look very strict or somebody who's very uncompromising, and this again helps sort of relax your face and your mouth. So these are the things that we can do with the lips. Another enhancement that we usually do with a lot of patients, especially of our Indian patients, young patients who want a pouty sort of a lip, is sort of increase or make these pillars over here just above the lips that go to the nose slightly more prominent. We don't make them very prominent, but a little more prominent. That again increases the pouty look to the lip. So depending on the shape and the volume you require, we can change how much filler we put, which filler we put. There are 2 different types of fillers as well. We can put a heavier filler or a lighter filler, and both of these will help with the lips looking better. Here the quality of fillers do matter a lot, because the fillers are going to be in an area that is going to be constantly moving. So we don't want very thick fillers, we want good fillers. However, they should also last for at least a year, if not more. And for that, the quality of fillers do matter, especially in lips. Again, you have to be careful. Sometimes when you layer different types of fillers in your lips, you may get increased swelling in the after period. If we do our lip fillers, basically what we want to do is we inject in your lips. We'll call you, it's an office procedure, you don't need to sort of do any big preparations for it. However, if you're a smoker or if you're someone on any blood thinners, you will need to stop them to decrease the amount of bruising that you may get, and the healing is faster. Immediately after doing the lip fillers, you will have some swelling. The swelling usually lasts for about 2 weeks. It won't be that they look beast tongue swollen. However, they will look a little bigger than what a normal lip would look like. This would settle in 2 weeks, and that is when you would get your final result. Hopefully this should stay for about a year, and you can enjoy the results for that time. Sort of a deep dive on lip fillers. If you have any more questions regarding lip fillers, any other fillers or non-surgical cosmetic procedures, do get in touch with us and we will definitely help you out. Thank you.